What's going on, ladies and gentlemen? Today we're here with Miss Angela. Now, the reason how she got on the show, I had put up a post on our the Phil Scott Show channel, which is our entertainment channel. If you're not getting entertainment news and you like to do that, go to that channel. Well, she responded to the email, and we were talking to her today. So, Angela, thank you for joining us on the show today.
Thank you for having me. So,
all right, Angela, you responded to the email, and we appreciate you doing that. But tell us a little bit about yourself.
So I've been a nurse for 30 years as of this year. So this year, 30 years. I was a trauma ICU nurse at level 1 trauma centers for a decade. And then I got my master's degree I got an MBA in healthcare operations. And so I do systems. I'm a systems person. And then I went back to school and I got an MS in nursing from Purdue University. So I come out of the University of Washington, which is Washington State is outside of Oregon. Washington is the whitest state you will ever step foot in. So nursing school at the University of Washington, it was tough. It was tough because, white women always think they smarter. So, yeah. So that's good about me.
Okay. So now you brought that up. I'm glad you did. So white women, let's talk about them a little bit, because it seems like white women, from my opinion, they will not allow, or at least attempt to allow, Black women to have no shine in anything. I mean, in anything. So you mentioned the school. Why did you say that they feel that they're smarter? Did their grades show that or something?
No, they just white women are naturally our competition as Black women. I don't ever compete against another Black woman, and I just don't do it. And so being as nursing is 85% white, they are my competition. No, they don't ever prove that they're smarter than me, because that's just not possible, because it's just not possible. So but what they do is they do backdoor stuff. They're liberal. Most of those white people up in Washington State are liberal white people that are full of themselves. They pretend like they're so Black friendly. They're not. They're not. They harassed me to death at the University of Washington. To death. And that wasn't the first nursing program I got in. So it wasn't like, and University of Washington is very difficult to get into the nursing program. But I was I got into San Diego State's nursing program. I got into Arizona State's nursing program. And then I got into the University of Washington's program. And I chose to go to the University of Washington because they're heavily research. I like research. I do clinical research. That's what I do. And I knew that I was going to traject myself, because my whole purpose of going into nursing was to care for my community and to make sure that my community, as a Black people, we get at least somewhat decent care, because they ain't trying to give it to us. We have to take it.
So you mentioned that they would harass you. Can you give an example of harassment?
Well, they harass me about my hair. They nitpick. White people nitpick. They can never come with.
Well, I don't want you to get past that. So I'm doing this for a reason. What would they point at you about your hair?
Oh, they didn't like it curly. They don't want it in its natural state. They want it to be like straightened, or they want me not to have a mohawk. But they will pick you apart about things that you have absolutely no control over. I'm not straightening my hair to make anybody happy. That's just not going to happen.
That's the perfect response. So, I love to hear that. I love to hear brothers and sisters, to don't conform, to them. Who are these people for us to be conforming to? They don't conform for us for any reason. There's a lot of things that we don't like that they do. But do we ask them to conform to anything? No.
Exactly. I don't ask people to conform to, fit my standards, and I'm not conforming to anybody else's standards. I conform to Angela's standards. Those are the standards that I hold for myself. I'm a Black woman. I'm proud to be Black. I've never been anything other than who I am in its purest form. My intentions are always known to white people, because if you don't let them know your intentions from the get-go, they always try to slick and slide out of stuff.
So you was in one of the whitest states in the union, and you know the state of Washington was created to be a white ethno state. So it's definitely a reason for that. And actually, black people was banned from even living in that state until the early 2000s on the books. I don't know if you knew that.
Correct. And so for Oregon too. The same for Oregon. It's a white haven, and it's supposed to be it's a predominantly white state. I mean, I think it's like 98% white, and they got like more Asians than they do black people. But you know, if you ever know any black people from the state of Washington, they're weird.
Oh no, are you saying Oreo weird, or how you mean weird?
Yes. They are, and they'll be as dark as me and don't realize that they black. And I've met several.
That's always interesting. See, I have no desire to be in those states because I just don't feel safe in a state where it's 98% them, and I'm not even a bleep on the population, because just from my research, the more in numbers they are, the more they're going to try you.
Oh yes, and that's why you have to. And they're the ones that taught me to make my intention known. That way we don't escape out of no ambiguity, because they like to create chaos so that you don't know what's going on. Smoke and mirrors, smoke and mirrors.
So after you got out of school, you went straight to a job, or what did you do after school?
When I got out of school, I went directly into burn ICU at Harborview Medical Center. Still the only black person. I've always been the only black nurse in the intensive care unit.
So why?
That's how I ended up. That's why I get discriminated against.
So why is that? Why are you the only person they're hiring?
Because they don't want any black people there. They made that perfectly clear. I was a travel nurse too for 7 years, and I traveled around the country, and I ended up in Wisconsin, and they discriminated against me there too. And I sued them, though. You're not going to do that. I sued them.
So basically, in healthcare, we've heard this many times about discrimination.
It's real.
Yeah, we heard this a lot about medical racism, etc. Right? So what are the things that black people should look out for when they go to the hospital dealing with these people? Because maybe some things that you saw that they like to do to black patients or black children. What should we look out for?
They like to make black people wait. Like they have exorbitant amount of wait times that for black people as opposed to the others. And then when they even come in to do, like if you come into an emergency room, there's only like 2 entrances into a hospital system that you're ever going to get. And that's either through your surgical services, which is what I specialize in, or through your emergency room. And so you can only come into the hospital that way. We don't do direct admits because that's crazy, but from like doctor's offices and things of that nature. So they'll just make you wait for an exorbitant amount of time. I had a situation where he was a professor, and doesn't matter that he was a black professor at Berkeley, and he came into the emergency room. And I can honestly say that if I had not intervened to have him given to a higher tertiary of care, he would have died because he had a ruptured ureter. And if he would have just died, and they were not concerned at all about this man who came with new onset everything.
Wow, so they make black people wait. And I've also heard, maybe you could tell me, that they like under medicate black people more than white folks. Is that true?
Yes. We don't have pain. Black people don't exhibit pain the same way. We don't, what white people don't understand is that black people are different from them. I know they like to think that we're the same and one love and what all that nonsense, but we are different from them. We are genetically different than them, and we are physically different than them. Our muscle tissue is different. Our vascular system is different. We are different. And so they undertreat our pain because they feel like we just don't have pain. Because we don't exhibit pain the way they do, we don't have pain. Or they undertreat your condition, they misdiagnose you, and once they've misdiagnosed you, they don't go back. They won't go back and say, I've made a mistake.
So you feel like for the safety and the health of black people, that we should be getting maybe seeking black physicians? Yes.
I have, me personally, as I've never had a white physician, ever. I've never had a white physician. I don't believe in them even having a say on what happens in this body. You know, a good book for people, Black Americans to read is Medical Apartheid by Harriet A. Washington. That book, it's going to tell you all the things that they've done to us throughout history, dating all the way back to slavery. It's going to tell you about Pfizer and their dumb eugenics program, because these people actually believe these recessive genes are better than ours. But it'll tell you all about the eugenics that Pfizer, the pharmaceutical company, used to practice, and especially practice in Africa, while Bill Gates is over there giving inoculations and stuff.
Yeah, I posted that picture on my Instagram. I said, wait a minute, this guy doesn't even have any medical degree. What in the hell is he doing? You know what I'm saying? And I get upset because, you know, they take advantage of the brothers and sisters in developing countries, you know, that they don't see. He won't try to come in one of our neighborhoods and pull that because he know better. But, you know, over there, yeah, it's free reign, and he can just walk in and say, hey, look, you know. So, but the good thing is about that is that we do have people on the continent watching. So, and they'll be watching you and hearing what you have to say. So, you know, they're taking in the information, and now, you know, they're getting that warning. So that's the only good thing about today. So, you know, we hear a lot of people talking about, you know, I think they just approved the, I got to be careful how I say this because they censor everything when it comes to this particular thing. So, you know, the new coronavirus V word, let me say that. They just approved. Yeah, it was. I think Pfizer too. Both of them, because I think
Pfizer.
Yeah, Trump just got on.
Hence the reason why I said Pfizer and their eugenics program.
Yeah. So there's also been reports coming out that people have been getting Bell palsy from this. You know, people having adverse reactions, and you notice that they just kind of push this on our community. If you notice that it's a big push, even though when you look at the raw numbers, more white people have died from COVID than black people, but yet the push is us, right? So is that normal in the medical industry for them to push new medications and new vaccines on the black community, like in modern times? No.
You know, it takes 10 years for real. You know, I have never my daughter, I have a 23-year-old daughter. My daughter's 23. And there was a point in time when the HPV virus vaccination came out, and they were, you know, saying, you know, they were pushing it on black girls, which my daughter's one, and that's just not going to happen. And I usually go with a firm thing. If it's 10 years and they've given it to white people, because you're going to give it to a whole bunch of white people before I ever have my black body touching it. So, because, you know, Bell palsy is a side effect of all vaccinations. Of all vaccinations, just given the way that they put them in the solutions and how they do it. And I see that Moderna had a black female scientist, and now Dr. Fauci is pushing that out there. And I'm not going to say nothing hide or there. I'm not taking it, and my family's not taking it.
Yeah, I'm with you. I'm not fooling with it either. Like I said, we need to see all these white people take it, and because, you know, especially the ones not wearing the mask and saying Trump 2020, y'all need to take it first, because see, that's a creation of Trump's. So, you know, take it first, and then I want to sit back and I'm gonna observe you for about 3 to 5 years and just see how it works. And
that's thinking smart. You know, we don't need to end up with no I am legend.
If it works out for the people who feel that they're superior to me and you, if it works out for them, then we'll halfway just even think about it. But I need to see most of them inoculated first.
Exactly, and that's my take on it, because I've been airborne on airborne precautions since March, because I knew it was airborne, and I knew it was airborne.
Well, that's the thing, you know. A lot of people, you know, they've been doing research and they're like, I don't know why black Americans just don't want to take it. And then, like you said, they think the old school game's going to work. Hey, look, we got, like you said, we got a black woman. She helped us, and have you seen her? She don't like black folk. You know, so
there's a lot of us.
Please put it in my arm, because she was a part of it. Like, no, them days are done, and thank God them days are done. Like, we understand, their so-called black representation is shucking and jiving, you know, Sambos. We understand that now.
They're the worst, and they're the worst. These, you know, you think when you work in, like I said, I've been a nurse consultant for 12 years. And so when you think you work in these positions where you're in a room full of Black people, especially in CDCR, in California Department of Corrections and Rehab. There are a lot of Black people, but the reason there's a lot of Black people is because there's a lot of Black people in prison. Make no mistake about it. These white people ain't trying to deal with no Black prisoners, so they get Black people to deal with Black prisoners. So you would think that, oh, in this environment, I'll be okay. Those are the worst. Those are the ones I got to fight against. Are my running and shucking Negroes. Those are the ones that I have to constantly let them know I'm not in with you. I know they done sent you here to spy on me, but that's why I just make my intentions known. So you just run on over there and you just let them know it's not happening over here. Because I don't want to have to file lawsuits against people, but I will. I have no problem with it if you push me to go there.
And have you won a couple?
Oh, yes, I have.
Oh, that's great to hear. You know, a lot of times Black folks are afraid to file lawsuits. You know, they have to wait till somebody die before they file a lawsuit.
Oh, no. I will. You break the law, even in policy and regulation. You break those. I'm gonna be the one, and they know I'm the one. I'm the one that secretly sends everything to the diversity people and to the EEOC at the same time. That's me. So you can get a letter from them letting you know that you've been brought up on charges.
Well, let me ask you a question about this, and I know there's something in the medical field too. They prefer to maybe bring a sister from, you know, Ghana, Cameroon, Nigeria, than bringing you in. Why is that?
Well, so we do have a lot of nurses, African nurses that work, especially in CDCR. There are a lot of African nurses that work in there. work for CDCR, and they're comfortable with people who don't run their mouth. They do not want me to be in those positions. And I can tell you, when I'm a nurse, I'm independent. So my position is not what I'm talking about. What I'm talking about is the hands-on nurses that are there. They don't want me in those hands-on nursing positions because they want to be able to run you over. And I say that because I just did a consulting case with a nurse from Sierra Leone, and they railroaded her. It was just plain and simple. And then they reported her to the California Board of Registered Nurses. And that's where she reached out to me, and then I had to help her with this because they literally railroaded her. And when she called me, she was up in a tither.
So basically what they try to do is to bring people in from the continent because they may not know their rights. They know good and well that, like you say, they'll be quiet because some of them just happy to be here and having an opportunity.
Yep. And they are real. They know they won't go to the EEOC. They know that for an absolute fact. I have heard them time and time again, African nurses tell me that they're not going to do that. They're not going to do that. Like they don't have a right to do that. If you're discriminated against, because in the end of the end, you're still me. I'm still you. These white people don't make a discernment on African versus African American. They're not, I can honestly tell you that. They see her, they see me. I'm just more vocal and she's silent.
Right. So with that being said, so what is the ways that we can protect ourselves as Black people in the medical field? Because, you know, like I said, you got, you know, Black folks got issues just like anybody else. Because, you know, we even heard of certain hospitals, Black folks like, don't go to that hospital because you may not come out of that one. So what can we do to protect ourselves?
You know, you have the right to, most patients don't understand that they have the right to refuse any service. You have the right to ask any question that you want. And you have the right to have every single question that you have answered to your satisfaction. There's no reason for you to, just because he's a physician, that you don't get to ask questions. Even if he feels like he's pressed for time or she's pressed for time. That's not, you are their sole purpose, which is to have good standard patient care. So therefore, you can ask whatever you want. And then if you're not getting resolution, reach out to the patient advocate. Every single hospital has a patient advocate. And if you're on Medicare and Medicaid, there's a patient advocate within those, the Department of Health and Human Services as well. So you have all of the rights. You just have to know you have all the rights. They don't have no rights. They don't have no rights.
You know, in this wicked system that we live in, You know, I'm just my mindset is maybe we should try to do our best to stay healthy so we don't have to even be in the crosshairs of them people.
Right. Right.
Because you know, some things that we can prevent out there.
Things that we can prevent.
Yeah, things we can prevent because you know it's just these people, like you said, they do not care about Black people like that at all. Now, with your training, have you ever thought about saying, okay, I'm gonna go to, you know, whatever country in the continent and start something there?
Yes. I've been trying to do that for 10 years.
Okay. So how,
and it's finally working its way out. So I'm real happy about that.
Oh, okay. I was about to say, because see, we need people like you to be going to the continent and growing those medical services, and because it's wide open for that.
Oh yeah. 2021 is going to be a good year. So I said, you know, I've been trying for 10 years, but then my daughter just graduated from UC Davis in June of this year. And so once she graduated in June, it was like a fast track. I'm a single woman and I have no children here. So I'm free to do what I want to do now. And so what I want to do is not be part of America at this time. So, and I've been trying to do this for 10 years. So I'm real happy that everything is starting to work out the way it needs to be working out.
And you know, like I said, I just believe, like I said, we need to connect worldwide, and that's just, you know, we can do things here in our local communities and also on the continent, because there's certain opportunities that's there that you not even have here, because you know, by living here, we're sabotaged all the way.
Every day. You know, I figured if I could go to, because I did a consulting job overseas in Ireland, of all places. But anyway, for the Cleveland Clinic out of Ohio. And so if I can go to a white country and just move there and don't know nothing about nothing, there ain't no way you're going to keep me from moving to a Black place. That's just not going to happen. So I've been, like I said, I tried to go through the World Health Organization to be a nurse consultant into Africa. They didn't want me. And then I tried to go through a different organization, the CDC, which I don't agree with everything the CDC, but I would rather have me as a Black person in Africa than these white people they send there. That's so I tried that, and then I was overqualified. And so I just decided I'm just going to up sticks. I don't really care like that. My skills are transferable.
Well, let me tell you something. They had this white woman that showed up in Uganda doing operations who had no medical training on Black children. And I'm pretty sure you heard of that story, Renee something. I forgot her last name. So with that being said, I guarantee you show up whatever country you're choosing and you start getting on the ground, you start getting involved with people, you know, find out who the Ministry of Health is and the different hospitals. It wouldn't be nothing like this for you to start getting connected over there. That's what I like about over there. You know, people want to, you know, you to connect with them and say, oh, you're Black American. Oh, you can do this. Hey, can you teach us? Can you, like, what do you know? You know, they get excited. You know what I'm saying? Over here, they're like, oh, they rolling their eyes at you. But over there, you know, it's like wide open.
Well, that is my hope that when I do get to where I'm going, that I won't have much, like, you know, issues, because I mean, I know that like where I'm going, I know they don't have, and I've also intersected with Rwanda, with the nurse there, she's like the head of African Nurses Association. Right. And so I'm intersecting with her and out of Senegal. So I'm thinking that where I'm going, since they don't have any of those things, they will be happy to have me as a consultant.
Oh yeah. They're going to be so happy to have you, and they're going to be so eager. Shoot, you maybe can even start a school and train nurses. I mean, it's just like they're wide open over there, you know, and bring all that 30+ years of experience, you know, to, you know, those countries and train the nurses in things that you know, and give them that knowledge that they leave their country for. You know, you can come right to you and get it if you set something up, and like you say, Senegal, Rwanda, etc. So I say push that, please push that.
That's what I'm going for. That's what I'm going for.
It's so needed on the continent. Trust me, it is so needed. But you know, Miss Angela, like I said, you know, if people maybe have a question for you, or maybe some young people that will have ideas about the medical profession, how can they get in contact with you?
Okay. You can email me. My email is adimu34@outlook.com.
All right, we'll make sure, ladies and gentlemen, to post, you know, her email at the top. If you have any questions about the medical industry, if you're a young person trying to get in, or you someone on the continent that, you know, definitely would, you know, tell her, hey, you know, we got an opening over here in Kenya, we got an opening in South Africa, or whatever, email her. You know, like she want to bring that wealth of knowledge, you know, definitely to the continent, and so y'all can grow in y'all medical profession as well. So, you know, Miss Angela, thank you for joining us on the show today.
Thank you.
Greatly appreciate you giving us all the knowledge.
Thank you so much for having me.